I had only heard good things about the MCC nursing program, and once I met the faculty, I knew this is where I belonged.
The demand is high right now across all healthcare field. This was a great time for me to get into this program and get out and start working and help the healthcare field.
The first time we started seeing patients, I finally realized, like, this is exactly where I'm supposed to be, and all this time was worth it.
There's nothing that can ever make you feel like this is not the best job. And there are jobs that can take you all over the world, that can take you into 10 different career paths in your lifetime. And the fulfillment that you get at the end of the day when you're just so honored to take care of people, there's nothing that will ever take the place of that.
Being able to see people when they're at their roughest and be able to be the eyes of the medical team, it's great when you know that your scan, your pictures contributed to their outcomes.
The way they create the program to help me learn, to help me go into a whole new scope of practice, it was so smooth. The caring, the compassion, the organization, you could just tell how the faculty were driven to just give us the best experience they could.
Getting into healthcare can be an expensive education, but going into MCC, they're really resourceful in helping us out and making sure we get there.
Everybody wants to see you succeed. All of the faculty is there for you as a resource, and they're available pretty much around the clock, and they're there to help you.
The professors, they're so incredibly patient. Their commitment to our learning is what really has helped me get through the previous semesters.
I worked for about 10 years in practice and wanted to do something a little bit different than the regular day, and so I started working here. I loved it, and I just kind of fell in love with working with the students. It's really cool when you see the aha moment, and when a student understands a concept and they're able to transfer that to patient care. That's really one of my favorite things.
Because I love to teach, I'm so thrilled when I find out that there's students out there who have gone on to become nurse practitioners, so gone on and done their master's degrees, their PhDs, and are now giving back and teaching in other colleges. So that makes me extremely proud.
I'm switching careers to become a nurse. I started off in another field of healthcare, and I realized during the pandemic that I was very passionate about nursing. I wanted the variety that nursing offered, and I also wanted the opportunity to grow educationally, possibly even to a nurse practitioner.
Knowing that we have these adult learners, just giving them the chance to come back for whether it's second careers, new careers, right, change of careers, or to have a career, right? I think that we do very well with flexibility and adaptability, with also holding that standard to that professional nursing and that professional student.
Basically roll out the carpet as far as supporting you, making sure that it's all tight-knit as far as a dental community, and making sure you're getting to where you need to go to be successful.
Not only do they want you to succeed, they want you to become the best tech possible, because this program here at MCC has a reputation, very good reputation, and I believe that coming here into this program specifically allows me to get a good job when I graduate, and knowing I come from a good, well-run program here at MCC.
Students graduating from MCC never have difficulty finding jobs.
I would absolutely recommend MCC to anyone who's interested in dental hygiene.
What I would say to somebody who's debating coming to this program is do it.
I would highly recommend MCC.